a person who had had an injury, an automobile accident, and then she had subsequently problems, all kinds of hypocapnic symptoms from my perspective, all kinds of problems in breathing. And she'd been told by an expert, it was actually a breath worker, who informed her that until she got an adjustment, the right adjustment from a chiropractor or a rehab professional of some kind, she would continue to have the problems that she was having. What was the problem? Her problem was, she said she couldn't get enough oxygen. Can't get enough oxygen. And as a result, when she would go home and go into her house, she would feel air hunger and she couldn't get enough oxygen from her perspective. So she would open the windows in her house. And when she opened the windows in her house, after 4 or 5 minutes and the house aired out, she could get all the oxygen she needed. As long as she was outside, or there was a breeze, or there was wind, there was no air hunger and she was fine. But as soon as she was in a closed space and the air was unmoving and quiet, she would feel like she wasn't getting enough oxygen. And of course, she was told by a number of professionals that she wouldn't be able to really get what she needed until she had some kind of an adjustment. And so I was at a conference and she was told to come and talk to me because I, quote, knew a lot about the physiology of respiration and maybe I could help. So she came and I hooked her up to a capnometer. And in that process, I looked at her CO2 levels. They were completely normal. We were in a hallway and there was a stairway. At the top of the stairway, there was a door that was open. And around the side of the hallway, there was an immense meeting room. And there were sliding glass doors in that meeting room. And I was sitting there with her and I said, how do you feel about oxygen right now? And she said, well, I'm fine. I'm getting all the air I need. This is great. I said, well, we're in a fairly closed space. We're in this hallway here. And she said, well, yeah, but the door upstairs is open and the whole side of the building is open around the corner over there. And I can feel the breeze in the hallway and I'm getting all the air I need. And as I work with her, she told me about her breathing work. She was a breath worker as well as a nutritionist. And she told me about the work she did. And so I engaged her in what she told me about, where she was taking larger breaths and so on. And her CO2 levels started to drop down lower than 30, which she was getting down into a moderately low level. She suddenly exclaimed that someone had closed the door. She said, someone's closed the doors. The doors are closed. The doors are closed. She said, someone's closed the door. I've got to go. I can't get enough oxygen, she said. And I said, no, wait a minute. I don't think anyone's closed the doors, all those sliding glass doors and everything. She said, well, they have. I can tell. I said, well, there's still a breeze in the hallway. She says, well, I know, but I can't get enough air. I've got to go. So I said, now, wait a minute. Can I work with you a few minutes? You're not going to die. Are you willing to work with me for a few minutes? And she said, okay. So then I worked with her, minimizing that breath, getting it to be small and so on, and getting her CO2 level. I was able, after about, I think it was 6 or 7 minutes, to get it close to normal, up close to 35. And suddenly she exclaimed that all the doors were now opened and it was a relief. I said, well, what do you think? She says, well, what I think is that what happens is that when I worry about getting enough air, I breathe too much and I lose CO2 like I did here. And that when I open the windows in my house, I stop worrying about it, stop thinking about it, and I start breathing normally. That's how she described it, something like that. So that she was able to discover for herself how, she was breathing under these different circumstances where you had a trigger for one habit and then subsequently a different trigger that came into play and you got two different kinds of breathing going on.